Clinical competency in electrodiagnosis and musculoskeletal ultrasound imaging is most important for the patient management and for better patient outcomes. Such competency is being achieved by rigorous examination processes that lead to board certification by the American Board of Physical Therapy Specialties through its electrophysiology clinical specialty exam and by the Alliance for Physician Certification and Achievement for Musculoskeletal Ultrasound Sonography.
Solving the puzzle of patient diagnosis leads to accurate treatments. Patients with symptoms of numbness, tingling, paresthesia, and weakness can be challenging to diagnose, and we know rather well, to treat a problem, we must know the cause of the problem.
The wrong diagnosis and treatment can not only prolong the patient's suffering, worry, and disability, but it can also be costly and even dangerous to our patients. There are the usual tests that can be done, all of the x-rays, the MRIs, and the blood tests. But what if all of those tests come back normal and we don't have enough information to provide a good diagnosis? In many cases, there is a quick, easy, and reliable test that helps us to pinpoint the cause of the patient's problem and begin proper, effective treatment. And just as important to me and my patients, rule out all of those dangerous things that we both worry about.
Electromyography and nerve conduction studies provide the physician with valuable information about the integrity of the neuromuscular system. Entrapment syndromes such as carpal tunnel or tarsal tunnel syndromes, but also peripheral polyneuropathies, radiculopathies, and myopathies can be confirmed with electrophysiology testing.
Physical therapists are qualified providers to perform competently electrophysiology examinations. Many of them obtain a specialist certification in clinical electrophysiology by the American Board of Physical Therapy Specialties and become recognized by the Centers of Medicare Services. Board certification requirements include at least 2,000 hours of direct patient care in clinical electrophysiology, the performance of a minimum of 500 EMG exams, and a passing score in a rigorous competency examination.
EMG certified professionals who are also physical therapists, and they do have a knowledge of kinesiology and joint range, motion, and function. So coupling a physical therapy training with EMG training is actually ideal because it helps them actually talk to the patient and figure out what potentially what test they could do and interact with the ordering physician to really determine what's the best test and what the best outcome should be.
I would totally agree that physical therapists are have the potential to be the prime providers to provide these services. The big reason why is that the training that we get in anatomy, in a neuroanatomy, in neuromuscular physiology, is better and more extensive than almost any other medical field, perhaps with the exception of a neurosurgeon.
Physical therapists who are appropriately trained to do EMG and nerve conduction testing have demonstrated in the marketplace their ability to be a provider of choice in electromyography and nerve conduction testing. The groundwork has been laid by the fact that in their physical therapy education programs, physical therapists go through an extraordinary amount of anatomy, physiology, neuromuscular anatomy, pathology, kinesiology. As far as a physical therapist's education in the evaluation of neuromusculoskeletal disorders, there are few, if any, professions who receive the education and training that would provide the foundation from which to learn the techniques in electromyography and nerve conduction testing.
I have absolutely no hesitation in recommending to my physician colleagues, physical therapists, to perform electrophysiologic EMG/nerve conduction study services. I look forward to being able to offer this service to many more of my patients in the future.
So quality care matters most to me, and electrophysiology testing has been an extremely valuable tool for my practice. I find that I can have the testing done and I can help the patients quickly and effectively.
For safe, competent, cost-effective, and accessible electromyography testing, trust your patient to an ABPTS clinical electrophysiology specialist. For more information and to find a therapist near you, go to www.abpts.org.
Hands-on diagnostics, in collaboration with the American Academy of Clinical Electrodiagnosis and the American Academy of Musculoskeletal Ultrasound, provide the only electrodiagnosis residency and MSK ultrasound fellowship programs worldwide, preparing students to not only provide competent patient testing, but also passing the exams with passing rates exceeding 90%. Here is what some of our faculty and mentors have to say.
Hey, it's Dr. Rick McKibben, Senior Faculty with Hands-On Diagnostics. I just wanted to congratulate all those that have achieved certificates, board certifications, and completion of their fellowships and residencies in musculoskeletal ultrasound and electrodiagnostics. Well done.
Hello everyone, my name is Dr. Mohini Rawat. I am Fellowship Director of Program in Musculoskeletal Ultrasound at American Academy of Musculoskeletal Ultrasound and Hands-On Diagnostics. I would like to congratulate our program graduates, Andrew Good, Andy Cahoon, Ben Larson, and Richard Keaton. Congratulations, guys. You have put so much hard work. It has been a long journey, and you have done very well. You have graduated from the program, and you have earned FMSK credentials. Very well deserved, and congratulations. I would also like to congratulate many of our course participants who have achieved point-of-care ultrasound certification and RMSK certification. Many, many, many congratulations. Thank you.
I mean, the sentence is one for me. Let us see your problem. That's the communication. Patients understand that the more you know, and that's so effective and very impressive, because you can really communicate with the patient the minute you do the test of where the problem is. You can pinpoint the problem real time, and that's fascinating, isn't it?
Yeah, hey everybody, this is Dr. Brooks coming to you from the Orthopedic and Spine Center here in beautiful Central Kentucky. I just wanted to give a shout out and word of congratulations to everybody that passed a board certification exam and to those who have finished any of the HODS training programs. Again, congratulations, and look forward to seeing everybody soon.
Hello, residency and fellowship graduates. This is Greg Ernst, director of the EMG residency program. Just wanted to say congratulations to everybody for your accomplishments. I wish you the best, and work hard and study hard for that ECS exam. It's not a gimme. So congratulations again, and best of luck to you.
Hi, this is John Lugo. I wanted to recognize the accomplishments of those who have achieved graduation of residency program status, who have achieved fellowship in musculoskeletal ultrasound, who have passed the specialty exam from the American Board of Physical Therapy Specialties in clinical electrophysiology, physical therapy, to attain ECS status, and recognize those who have completed the Diplomat Certificate course of the American Academy of Clinical Electrodiagnosis. That is a great accomplishment for all of you that have done this, and I've congratulated you, most, if not all of you individually. But I also wanted to challenge you now that now you are recognized as a leader and a skilled professional, that you now become a leader in the profession and advocate for the patients and advocate for the practice of these diagnostic testing services in the physical therapy community. So I congratulate you, and I challenge you to become leaders in the field. Thank you.
We are so very proud of the achievements of our recent graduates. They have achieved excellence and competence in their areas of expertise, and they own or work in a HODS-approved diagnostic center. Here is what some of them had to say.
My name is Jennifer Howsky from 101 Physical Therapy and Aquatics, which is a HODS-approved diagnostic center. Getting my ECS means for me and my patients that we can be the most certain that we possibly can about what's going on with the nerves and muscles in their body. We can find the location, the severity, and then find the right treatments that's going to get them better faster, which is what we all want in physical therapy, right? HODS for me has provided so many resources and people and courses, information that I never thought I could possibly have or gain from this program. I feel confident that I can go in every day, go through EMG, nerve conduction study testing, and be accurate and be appropriate and know what to convey to my patients. Thank you, HODS, for all your support, and let's keep rolling.
Hi, this is Bart McDonald from Superior Physical Therapy and Diagnostics, a HODS-approved diagnostic center here in Idaho. We are so thrilled to report that I was able to pass my clinical electrophysiology board exams this year. And with that has come a dimension to our practice to be able to provide better diagnostic information, both through EMG and ultrasound, and the fellowship that comes through HODS, for our patients to have a better outcome through better diagnostics. Come and join the diagnostics movement within physical therapy.
Hi, my name is Ben Larson. I'm a physical therapist at Teton Therapy in Cheyenne, Wyoming, which is a HOD-approved diagnostic center. The fellowship means to me that it's greater training in my ability to better diagnose my patients and show them how to help improve upon their condition. This particular fellowship was a long road for me, but it taught me a lot in how to better treat my patients and better understand the musculoskeletal impairments that they have. PT with diagnostics is helping us better treat our patients by knowing the root cause of the issue. Within our facility, we've been able to treat people much more efficiently in a manner that helps them really get to the point of what their condition is and what is causing that condition. So with this particular musculoskeletal ultrasound that we've been trained in, it really helps us to really pinpoint the issues within the musculoskeletal system and come up with a treatment plan that really helps the patient get better sooner and get better results.
My name is Breck Leonard. I work for Oasis Physical Therapy in Pasco, Washington. I recently finished my AACE residency, and I have also been approved to sit for the 2021 ECS exam. One of the ways that EMGs and nerve conduction studies have really helped our business is to just provide answers for patients that they wouldn't get otherwise and to be able to provide better care for them.
Hello everyone, my name is Dr. Andrea Cahoon from Total Body Therapy and Wellness, and we are a HODS-approved diagnostic center. As a provider in a rural community, we see a wide range of patients with multiple musculoskeletal issues and neurological conditions. The addition of diagnostic testing to our physical therapy practice has helped provide answers to those patients looking to resolve their pain. With the use of musculoskeletal ultrasound, we have been able to precisely determine the site of injury or pathology. Therefore, our plan of care can be adjusted accordingly. The patients love knowing and seeing what is causing their pain. Therefore, they are more confident in the treatment you have for them. Patients tell me all the time how safe and easy it is to get the ultrasound testing. And most importantly, they're very excited to get the results quickly, so they know what's going on and they're more confident in you and your treatment plan. Thank you, HODS, for providing us with the resources, courses, and information we need to improve the physical therapy profession in our small town.
Hi, my name is Dr. Andrew Good. I'm with Superior Physical Therapy in Pocatello, Idaho. I have been with, which is a HODS certified center. I've been with Superior for 5 years and I have been with HODS for 3 years now and have had a tremendous experience with the fellowship program. I've been very grateful for my experience that it's allowed me to provide for my patients in education and allowing them to have a better understanding of what's happening with their body. I'm also a certified dry needling therapist and find it to be very useful in the application of that treatment. And I'm really excited to see where it takes us into the next generation as far as therapy is concerned and take us into the beyond 2020. Thanks.
Being a small practice right in the middle of ground zero of the hospital super monopolies, ECS has opened up new sources of revenue. and has given the potential to not only exist, but to thrive again, despite the competition that the hospital groups pose. ECS has given me the personal confidence I needed and the credentialing I needed to speak with doctors intelligently about the benefits of electrodiagnostic testing and why the testing is beneficial and when the testing is appropriate. HODS has been and continues to be a tremendous driving force in elevating our profession towards autonomy as we continue to carve out our unique and important role in healthcare. Thank you, HODS.
Hi, my name is Dr. Jessica Collins from West Park Rehab in Franklin, Pennsylvania, which is a HODS-approved diagnostic center. Incorporating EMG into our physical therapy practice is helping us to deliver improved services to our patients.
Hi, my name is Josh Vance from Vance Physical Therapy and Wellness, a HODS-approved diagnostic center. For me, completing my fellowship in electrodiagnostic testing helps me be able to provide my patients and the community with high-quality tests that are accurate and able to help them. Additionally, then we can take that information into the PT setting and we can help them with the clinical picture that they're having issues with.
Hello everyone, my name is Dr. Kajal Jani. I am from Dynamic Physical Therapy, New York, which is an HODS approved diagnostic center. I earned my ECS certification this year in 2020 and it's a proud moment for me. ECS is an honor and for me it's an entry to a elite physical therapy specialist group. It is also a responsibility and commitment for lifetime learning and uplifting our physical therapy profession. And for that, I'm really thankful to HODS for the opportunity and their amazing mentors who help us each and every step of learning and help us get through this. And it is really commendable what HODS is doing. And I feel that physical therapy with diagnostic, it is very beneficial for our patient to get them very efficient treatment plan, to know their scope and severity of the condition. So I feel it's a better PT management also. Keep it up, HODS, keep it up. Thank you.
HODS and the diagnostic ultrasound has absolutely revolutionized our practice. As providers of direct access for a lot of athletes and an active community in which we live, we no longer need to refer to doctors for appropriate diagnoses. We can treat the patients ourselves. And this has led to the unbelievable growth that we have seen since bringing aboard the HODS program.
Hello, Joseph McGilvery, PT ECS of Apex, which is a HODS-approved diagnostic center. Becoming board certified in ECS has absolutely strengthened our ability to become the focal entry point into the healthcare system among everybody in our community. Having diagnostics, which is including EMG, NCS, and also MSKUS, has absolutely allowed us to provide a much quicker and better diagnosis for our patients, which then allows us to provide laser-focused treatments, which allows our patients to move better, feel better, and live better.
The following have achieved new statuses and have graduated from a program: Jeff Coursier, EMG residency graduate and ECS; Anup Chako, EMG residency graduate; William Dodson, EMG residency graduate and ECS; Jessica Collins, diplomate in the EMG program; Bart McDonald, ECS; Jennifer Hosky, EMG residency graduate and ECS; Kajal Jani, ECS; John Dragan, EMG residency graduate and ECS; Breck Leonard, diplomate in electrodiagnosis and EMG residency graduate; Ting Oh, diplomate in electrodiagnosis; Daniel Neff, diplomate in electrodiagnosis; Joseph McGilvery, diplomate in electrodiagnosis, residency graduate and ECS; Rajeshwari Sani, diplomate in electrodiagnosis; Adam Soltis, diplomate in electrodiagnosis; Joshua Vance, Diplomate in Electrodiagnosis. Andy Cahoon, FMSK, Fellowship in MSK Ultrasound, also Point of Care Ultrasound, and RMSK. Ben Larson, FMSK, Fellowship in Musculoskeletal Ultrasound. Richard King, FMSK, Fellowship in MSK Ultrasound. Rinku Kuril, RMSK. Andrew Good, FMSK, Fellowship in MSK Ultrasound. Shan Ajofabaji, RMSK. On behalf of the Board of Directors of Hands-On Diagnostics Franchising, the American Academy of MSK Ultrasound, and the American Academy of Clinical Electrodiagnosis, congratulations. We count on your continuing progress and success. The profession counts on you. Our patients count on you. Keep working on providing the margin of excellence in diagnostics. Thank you.